So the CDC is expecting hospitalizations to increase in the next few months. We're also hearing that mask mandates are coming back for hospitals, clinics, restaurants, and even hotels across the United States. However, it is mainly stemming from California and even New York. Now today I want to break down what's going on, why we are seeing this mask mandate come back, and guess what? It's actually not because of COVID. So I'm going to break all this down in just a moment, but all I ask is one thing. Takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now let's begin. So let's jump right into it. Look at this. It says CDC reveals when to expect hospitalizations to peak this year. Well, guess what? They are expecting hospitalizations to peak for COVID patients. However, the main illness will not even be COVID. No, that's what we're hearing. The main illness right now, according to the CDC, is walking pneumonia in kids. This is the big issue. Kids will get walking pneumonia. They will go to school. They will go to a park. They'll go play with their friends. And guess what? They'll pass it from one child to the next. This is what we're seeing. Now, I want to read a little bit of this to you. It says right here in the brief, the Centers for Disease Control released a notice about the rise in a form of walking pneumonia called myoplasma pneumoniae among children. Infections can happen at any age, but occur among kids ages 5 through 17 years old and young adults. Symptoms of mycoplasma pneumoniae can include fever, cough, and a sore throat. With symptoms, people may not stay home or in bed, which led to the phrase walking pneumonia, according to the CDC. So again, it is a form of pneumonia, but again, people don't feel sick, right? Sore throat, I'm okay, right? Little fever, it's not 105, just a slight fever, right? Little bit of a cough. They go to school, right? Go to school, they spread it around. This is part of the issue, because now, and let's say it's young adults, ages 16 to 21, right? And those people go to a restaurant, right? Spread it around to the wait staff. They go to a hotel room, right? And maybe they spread it around to the housekeepers, right? The people at the front desk. They go to just a sporting event, spread it around to the people that are watching or even some of the people that are attending, right? And so this is part of the issue. Now, I want to read this to you. It says, walking pneumonia, acute bronchitis cases are on the rise. How to prevent the spread? Well, here's the thing. The CDC is going to tell you need to go and get a vaccine, okay? Go and get a flu shot. Go and make sure your vaccines are all up to date. That's what they're going to tell you. The simple thing is, if you're not feeling well, just stay at home. That's it. But here's the issue, and this is why I'm bringing this to your attention today. What we are now facing is a pretty big crisis. And the crisis isn't necessarily the health risk. The crisis is regarding your financial situation. For the majority of Americans, they have no savings. They've spent that all. They have no backup as far as a credit card because they're maxed out. Okay, so those are issues. But yet they need to continue to make some money so they can pay for their rent or their mortgage, put food on the table, continue to make their car payment, put gas in the gas tank, right? All important things. But here's the issue. If you have pneumonia because your child just gave it to you, you probably are still going to go to work because, well, number one, you probably never went to the doctor to get checked, but you do have a slight fever. You do have a cough. You do have a sore throat, but it's okay, right? I only work in the fast food industry. I only work in the restaurant industry. I'm a server. And so here's the problem. You don't work for 2 or 3 days. You don't make any money. You make nothing. This is why many Americans are now going into work when they're sick because they don't have sick days. They don't have any spare income coming in. Okay? And so now the issue is this. It's not, well, how do we prevent the sicknesses from going around? It's just wear a mask. Mask mandates are now coming back. Look at this. Okay? This article right here from Newsweek says mask mandate map shows where they are coming back. Well, this is specifically just in the state of California as of a week ago. You can see it right here. Okay? You can see in Napa, it says, yes, healthcare workers only have to wear a mask. Down here in Contra Costa, no, but wearing a mask is officially recommended, so there's no mandate there. Right here in Alameda, yes, healthcare workers only. Right here in Santa Clara, healthcare workers only. And right here, San Mateo, yes, healthcare workers and visitors. Now, here's what's interesting. It's not just in California. It says, this article right here says pneumonia uptick, part of decision to reintroduce mask mandate in NL disease specialist says. Now, here's the interesting thing. Okay, these mask mandates are starting to come back, but it's not necessarily just for the customers. It's more for the workers. This is where the mandates are coming in. Because customers are coming in, and let's say you work in a restaurant, they're going to take their mask off. They're going to just interact. They're going to eat. They're going to drink, whatever they're going to do. They can't do that through a mask. But the waiters, the wait staff, the cooks, right, the managers, all them, the servers, okay, your busboys, all those people can wear a mask and do their job. This is one of the reasons why we're starting to see mask mandates slowly come back. Now, I want to leave you with this one last thing. I don't think mask mandates are going to come back and hit the United States in full force. I just don't. Okay? I don't think a lot of people want them. I don't want to be required to wear a mask. But at the same time, if you want to wear a mask, go for it. Even now, I still see people driving by themselves with a mask on. Okay, that's fine. I still see people that are driving for Uber wear masks. Yeah, they still wear a mask. Okay? In clinics and hospitals, many of the people are still wearing masks because they don't want to catch something that somebody coming into their clinic currently has. I get it. So now more people are being, very cautious that they don't want to, catch something that somebody else currently has. So great. But really, it's on you or on them. So I will leave you with that, but just understand at this time, yes, the CDC does warn that hospitalizations are going to increase, but the good news is they will likely be less than what they were last year as far as COVID is concerned. As far as other infections and diseases, well, that we will have to wait and find out. But that is what we know as of today. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.